morning. I'm Dr. Sean Coomer, a transplant surgeon and the Chief Medical Officer here at University of Kansas Health System. Welcome back to Open Mics. Every 3 seconds, someone worldwide develops dementia, yet there is still a large debate on what speeds up cerebral aging. A new study is investigating if COVID infections may have aged our brains, whether you've tested positive for the virus or not. The study out of the United Kingdom is tracking MRI imaging. Researchers found a 5.5-month acceleration in aging associated with the pandemic, something Dr. Mario Castro, the Vice Chair for Clinical and Translational Research, said is a solid methodology.
We talk to our patients with long COVID. Often their whole life has changed, and they do feel like they've aged quickly. And so now we have some evidence that, on average, some patients, on average, their aging effect was about 5.5 months, more than we would expect for normal aging alone. And so that acceleration, now we have some solid data behind it. I mean, obviously, some patients are impacted more than others in terms of that aging effect. And so there's going to be that variability, but at least now we have some solid evidence behind that. And it would also allow us to kind of think about, well, how do we prevent that? You know, how do we even go about reversing that aging effect? And I think that's kind of the next step.
Joining me to investigate these claims are Dr. Sarah Hahn, a practicing neurologist and the Vice President of our Neuroscience Service Line here at the health system, and Dr. Brandon Comfort, an internal medicine specialist who directed our long COVID clinic. Dr. Castro couldn't join us this morning. He's traveling to present his own research studies, but he visited with us before leaving, so we hear his take on the research throughout our program. Dr. Comfort, you saw patients firsthand with brain fog, headaches, and other symptoms. How did these research findings resonate with what you saw in your clinic?
They definitely resonate. And, you know, when we had the long COVID clinic up and running, I mean, we saw hundreds of patients that suffered from these types of symptoms: brain fog, memory troubles, you know, trouble balancing, you know, complex cognitive tasks, so to speak, right? Doing their jobs, doing their work, and that sort of thing. You know, at the time, we knew what we were seeing, you know, and the patients could describe the what, you know, but it was really the why that we didn't have any answers for. And so I think studies like this and others that have come out over the last few years are giving us a glimpse of that answer of the why. And that's going to be really important, as Dr. Castro had mentioned, of, you know, how do we prevent this, how do we treat this, and that sort of thing. So it's an important study that adds to kind of our understanding of this disease.
Yeah, it's definitely multifactorial. What's causing dementia, of course.
100%.
It's just one thing. Dr. Castro mentioned this study had solid methodology, which is really the foundation to make sure your results are accurate and trustworthy. Dr. Hahn, can you explain how you determine whether a study has solid methodology or weak methodology?
Well, there are many components for sure, but some of the key features that we look for to try to identify a solid methodology is for the study to be objective. We want the scientists not to have a preconceived notion or some sort of reason that they would want to come to a certain conclusion. We want them to be more objective and open to what might be there. And of course, we want to make sure that the data is solid, that the facts are collected accurately, and that the most appropriate statistical methodology is used, and that the sample size is adequate. And then of course, we want to make sure that the study is repeatable. And to Dr. Comfort's point, we've learned a little from this study, but we need to learn a lot more, and we'd love to see some of this repeated.
Yeah. I mean, dementia this is probably not the most common cause of dementia or accelerated aging, I'm sure.
Yes, I would assume that's exactly right, but we still don't know exactly what COVID-19 does to our bodies long term. Mm-hmm. We're just 5 years from the beginning, really, of the pandemic, and we've got many more years to study.
Let's see the differences of a younger and an older brain. On the left is what your brain looks like at age 30, and on the right at age 60. Dr. Hahn, the brain doesn't shrink when you hit a certain age. It's a gradual process. Can you explain that process, and where on the brain does that actually happen?
Absolutely. It is a very gradual process, and we typically use the statement, last in is the first out. So the last areas of the brain to fully develop when we are ending adolescence are typically the first to begin to deteriorate as we get older. That aging process occurs gradually over decades, but then begins to speed up a little bit over the age of 60. In the pictures that we see here, on the left you have a very young person's brain. And if we look at the top of those pictures, sort of from maybe 11 o'clock to 1 o'clock, you see the frontal lobes that are very full, robust, pushed out almost to the skull area. That's nice and normal full brain. If we look to the right on those same areas from about 11 to 1 o'clock on the photos, you can see that the brain has begun to pull away a little bit down from the skull. And those are the first areas that we often begin to see shrinkage or deterioration, followed not long after that by temporal lobes and even the overall white matter, which we can see on both of the photos as well. And so initially, when the frontal lobes are affected, we often see difficulty with executive function, changes in personality, difficulty with decision making, disinhibition or difficulty with impulse control. And then as the temporal lobes are affected, we begin to see changes in memory, changes in language, both spoken and written language, and some changes in people's ability and creativity as well. And then with white matter changes, you see just overall decreased connection between all of these super important areas in the brain. And that just occurs gradually over time, but speeds up as we get older.
So it gives a whole new meaning to becoming frontal. Right?
Exactly, no question.
The NIH created a Recover initiative, which uses a collaborative approach to research studies regarding COVID. The University of Kansas Medical Center is a part of that. Again, here is Dr. Mario Castro.
In Recover, we are trying to first understand how COVID affects patients over time. And we know that the term long COVID is helpful, but not too helpful, in that long COVID means about 5 or 6 different things. So we know some patients have memory problems. Other people have disability in terms of actually being able to get up out of bed, in terms of physical deconditioning. Other patients have effects on their lungs that are long-term. And as you can imagine, from a physician standpoint, treating those are very different treatments. And so our efforts now have shifted from just looking at long COVID as one thing to actually understanding all the different types of long COVID that there is, and then testing new therapies on those. Could we help people better with their memory loss? Could we help people with their physical conditioning? And how do we do that, knowing what we know about how the virus impacted a patient's muscles and their nerves and so on? It is pretty unique in how it's impacted patients, and so we have to be really, to help our patients, we have to really study it well, and that's what we're doing currently in Recover, is studying each of these conditions, bringing in our best specialists to work together to really figure out some good solutions for our patients.
Dr. Comfort, anything to add to what Dr. Castro said?
Yeah, I mean, that matches our experience in our long COVID clinic. And, I really consider long COVID as kind of an umbrella term. And then underneath that is these kind of different groups of symptoms that we saw. And I think, the most common thing that we saw was this fatigue, debilitating fatigue. I mean, we're not talking, I'm burning the candle at both ends, normal type of fatigue that you can't get out of bed, you can't go to work, you can't take care of your kids and that sort of thing. I mean, that was a really devastating part of this. I think a second kind of bucket of symptoms we saw is what we're talking about today, this brain fog, neurologic sequelae. We saw a number of dysautonomias, and we've talked about that on this program before, like postural orthostatic tachycardia syndrome and some of those. We saw a lot of people develop that after having COVID infection. Probably the next most common bucket is pulmonary complications, shortness of breath, chronic cough that just lingers and lingers and lingers, for months, if not a year or more. And then we saw all sorts of other things, right? Skin rashes that we couldn't really explain, or muscle aches and weakness, GI symptoms and those sorts of things. But those big 3 buckets, the fatigue, the neurologic symptoms, and then those pulmonary symptoms were definitely the most common that we saw in our clinic.
And you mentioned dysautonomias and orthostatic. Yep. Can you explain that a little bit more for the viewers?
Yeah, the autonomic nervous system is that part of our nervous system that that we don't think about until it doesn't work right. It takes care of all these autonomic processes, how our heart beats, what our blood pressure is, whether we sweat or not, or our bowels move, and things like that. And so, when that's not working right, we definitely saw a number of those things. People whose heart rate wasn't regulating the right way with positional changes and things like that. And as you can imagine, that is a very tough thing to live with. It can really impede your kind of day-to-day activities.
Absolutely. Don't want any of those. Dr. Hahn, anything else to add?
Well, certainly we need more studies, and we need to really know exactly how not just the virus has affected us, but everything surrounding the pandemic. One of the things this study talked about was whether people had had a documented infection or not, they had some of these brain effects. How much of that was related to subclinical infection, people just didn't test positive, or whether it was related to things like social isolation. That was a really significant issue during the pandemic. If we extrapolate a little bit from what we know in older people and the development of dementia or Alzheimer's disease, there are definitely factors that we know contribute to worsening of the condition, definite risk factors. Social isolation is clearly one of those that we know of. And so whether that has implication here or not is yet to be determined, but certainly is possible. And what we have been doing without great data, we're hoping to get more, is encouraging people to pursue the same lifestyle changes that we know make a difference in terms of both prevention and slowing down progression of dementia. Things like eating a very healthy diet, exercising regularly, staying very socially engaged, making sure that folks are learning new things, keeping those neurons and those connections rolling, and overall decreasing stress and increasing resilience. We know those are super important for all of us for brain health, and we will certainly learn more as we move farther from the pandemic.
So there was a 2024 research study from the University of Washington that looked at teenagers' brains during the pandemic. It found that boys' brains had aged the equivalent of 1.4 years extra during the pandemic, while girls aged an extra 4.2 years. Dr. Comfort, what were the main symptoms you saw in these teenagers here in the health system?
Yeah, so most of the patients we saw were probably in their, 40s, 50s, 60s. We saw a number in their 20s, but there were definitely some teenagers that developed this as well. And so, I think some of these kind of brain fog type of symptoms were pretty common, kind of described as like trouble concentrating or almost like mental fatigue, right? Doing their homework or something like that, and just, getting tired much quicker than they would have before. And then I think these dysautonomias, as we kind of mentioned before, and generalized fatigue were some of the most common symptoms that we saw.
Probably hard to differentiate some of those symptoms from a normal teenager, I imagine.
Yeah, in some ways. But these were a little more dramatic. I mean, these were pretty intense symptoms for most of these folks that we saw in the clinic anyway.
So the average age of your long COVID patients is about what?
So in our clinic, our average age was in the early 40s. And I think a lot of studies would show 40 to 60 was kind of the biggest number of patients. Now, we do know that there's high risk in our younger patients as well. And then as people age, that risk went up as well. But in terms of just raw numbers, that kind of 40 to 60 group is our most common.
So infection is one part, but beyond that, we know that stress, isolation, inflammation can affect the brain. Dr. Hahn, how much of this alleged aging is connected to the stress of the pandemic versus the virus itself?
Well, that's the million-dollar question, and we just don't know. We're hoping over time we get some better answers. We know that much of what Dr. Comfort was describing, even non-neuro symptoms, may well be related to inflammation and sort of a charging up of the immune system, and then how our bodies responded to that. We know that inflammation as a whole process and cascade that happens within the body, including within the brain, leads to chemicals, neurotransmitters that do some harm, for sure. And we've seen that in lots of other conditions and how it has affected the nervous system, how it's affected the brain. And that has probably played a role here as well. We've seen that, for example, in patients that had various inflammatory conditions acutely during the COVID-19 infection. As well as stroke, definitely exhibited some pro-inflammatory process. And those definitely can lead to rapid deterioration in various parts of the brain. So easily, that's a piece, but we don't know how much the social isolation or even just the stress related to the overall pandemic. If you think about the downstream effects for folks financially that weren't able to continue in their regular jobs and other areas, those may have contributed as well. More to learn.
If this study does indeed show the brain was changed by the pandemic in meaningful ways, what would that change for potential pandemics in the future? Once again, here's Dr. Castro.
Yeah, I think the lesson, and there's so many lessons we have learned from dealing with COVID, is that we need to be very cognizant of long-term effects from a virus, and we need to have plans in place how to prevent those from having those negative impacts. I'll give you an example. During COVID, the first reaction we had was isolation, complete isolation. We know isolation in terms of brain aging and memory effects is the worst thing possible for you. And so maybe we have now a little bit better approach to combating a new pandemic, and we think about, well, we got to really strategize to not isolate people. How do we do that effectively yet protect, public health and keeping that foremost in mind? So we've gotten very creative. I mean, we all use Zoom meetings nowadays. That never existed before. There are creative ways to combat social isolation, to combat that loneliness that a lot of my patients experienced because of COVID. And so for new viruses, new pandemics, I think we'll actively integrate that in the care of our patients as we go forward.
Dr. Hahn, anything to add?
I agree 100% with what Dr. Castro said. Social isolation, we can't emphasize enough how much it's a problem, and stress in general related to the pandemic. And it really does inform how we will handle something like this in the future, I believe.
Dr. Comfort?
Yeah, I mean, I agree. We saw it every day. We actually, in our primary care clinics at KU, we screened for loneliness and social isolation, and we saw a clear trend up during the pandemic, and I think we've seen a number of studies highlight the downstream effects of that on health, and it can be really quite severe. But I do think this is a little bit of a yes and, right? I mean, if we remember back to those early days of that pandemic, spring 2020, I mean, that was a devastating time, and we saw all those. I mean, we remember that, right? Those of us who were kind of in the trenches, and so those isolation measures saved a lot of lives in that short term. But I think there's a way to kind of do a yes and here, kind of balance that, and I think we have much better tools now than we did in 2020, or we're better at it, right, with Zoom and Teams and FaceTime and those sorts of things to make sure that we're maintaining those social connections.
Yeah.
Well said.
So we're here to answer your questions. Please send them in using the links on your screen, YouTube, Facebook, or email the Medical News Network. Let's check in with Doc Hawk. Travelers who were at Kansas City International Airport were potentially exposed to measles earlier this month. Measles is highly contagious. Doc Hawk, what do people need to know, and how worried should they be?
Yeah, again, we're talking about another virus here, just as we were talking about COVID. Unfortunately, public opinion is that these viruses cause very benign disease without any problems. That's not true. As we've seen with COVID and long COVID and the potential for severe disease, the same is true for even an older virus, an older infection that we have known about and has plagued our society and everybody in humanity, and that is measles. And measles is a very old disease. It used to cause a lot of severe disease and infections and even death. We had largely eliminated it, though, because we have medicine, science. We have good data to back up the fact that we have a very safe and effective vaccine against this disease. So what do people need to know? Again, it is a viral illness. It is one of the most contagious viral illnesses that we have. It can cause certainly a prodrome, regular symptoms of maybe a cough or cold, such as high fever, cough, runny nose. That is in the first couple days. boys. And then it develops into the rash that people are more aware of, the measles rash. It typically starts on your face and your head and moves down to the rest of your body. Unfortunately, it can also cause significant complications. There is 1 in 20 people may go to the hospital. 1 in 20 may also get pneumonia. There can also be, unfortunately, deaths, though, that we have already seen right now with the outbreaks in the United States and with the increasing cases. 1 to 3 people may die because of measles itself. The best protection that we can have is MMR vaccine, measles, mumps, rubella vaccine, that has been used for decades, has been proven to be very safe and effective. But unfortunately, what we have seen over the past and it's actually been accelerated over the past few years, is declining rates of measles, mumps, rubella vaccination. Again, most people have to get them prior to going to school. Unfortunately, we are seeing just more exemptions, more people opting out, more people just not wanting to get the vaccine. But also we have to know that certainly access is limited for certain populations around the country as well to medical care. So there are a number of reasons why MMR vaccine rates are decreasing, but this has certainly added to the increase in the number of cases that we've seen throughout 2025. And actually what we have known is that CDC data has shown, just as I said, decreasing rates as far as putting numbers to it. The MMR vaccine for kindergarten is because that's really what we look at, is who is entering into kindergarten and who has gotten the vaccine, dropped to 92.7% for the 2023-2024 school year. Unfortunately, for herd or community immunity, we really like to get that vaccination rate above 95%. Why is that? Because if you have 95% of the population protected, the chance that it will infect somebody and spread to others is extremely low. So I think that is the important thing to remember, is we have fallen, we would say significantly under 95%, even though it is those few percentages. We have shown that it has had a significant impact on the number of cases, hospitalizations, and unfortunately even deaths in our country due to measles now. So I think that is the important thing to remember as well. And people ask, well, what about protection? What if I wear an N95 mask? Certainly we know that in the hospital, in these healthcare settings, we do wear, again, fitted N95 masks that can aid in protection from getting the measles virus, because what happens is people will inhale it, and that is how they get infected with measles. But unfortunately, that isn't the best strategy. The best strategy is to get vaccinated to have protection against measles disease. And why is that? Because measles is extremely contagious, just as I said. It is contagious if you are in a space with somebody with measles. But unfortunately, Sean, as we know, that measles virus can linger in that space, such as a high-trafficked space, such as an airport, a bus station, train station, a party, any other gathering, church, stores. It can linger in that space for up to 2 hours, and so somebody can come in even an hour later and walk through that space and have potential exposure to that virus. So that is why it is important. Yes, N95 masks can offer protection, but we don't advise going that route. The best and safest protection is to be up to date with your MMR vaccination.
And those measles virus particles can stay in the air for 2 hours. So
yes.
In KCI, there were 2 days, November 5th and
Yep.
November 10th,
Yep.
where people could potentially have been exposed, right?
Absolutely. And we would like to say, too, is that you are considered protected if you were born before 1957 or if you have had 2 doses of the vaccine. Now, we would say that that vaccine is 97 to 98% protective. So there can be some breakthrough cases even if you do have the vaccine, because the vaccine is not meant to protect against infection. It is meant to protect against disease and the severe cases of disease. So we have even seen in some of the cases here in the United States recently, there have people who've been vaccinated, have had the disease, but it is much lighter, much less significant. You don't spread it as much, and you have certainly decreased risk of those severe complications. So the best path moving forward is to check your vaccine status. If you are not up to date and have had 2 doses of the MMR vaccine, please get up to date.
Yeah. MMR vaccine is certainly more effective than N95, especially since N95s are not usually fitted correctly. So
That's absolutely right.
So we know many of you have questions, so let's head to Studio B with Dr. Del Cid.
Good morning, Dr. Coomer. Gene Reardon has a question. He wants to know, why would there be more detrimental effects on teenage girls versus teenage boys?
You want to take that one?
I think we don't know, Brandon, unless you've got a good answer for that.
No, but
yeah,
I don't.
I thought it was interesting.
It is interesting, and I think one of the things that supports to me is when we saw that females were more likely to get long COVID than males. We don't really know why that is, but that certainly was our experience in our long COVID clinic, and I think that matches medical literature on that sort of thing. So it may just be kind of an exposure risk sort of thing. I don't really know, but
So there were more females in your long COVID
definitely,
clinic
yeah, it was
than
probably a
males.
2-to-1 ratio,
2-to-1.
I would say.
Wow.
Yeah.
And what about the just having? Did they get exposed more? Did they wind up having more infection, more COVID incidences, or we don't know?
Yeah, we don't know. And there's a number of kind of hypotheses out there around a little bit more prone for autoimmunity in the female population and things like that, but those are just hypotheses at this point. It's not really been proven one way or another.
Joellen McGranahan would love you to expand on something that piqued her interest earlier in the program. She wants to know, would you please speak more to the comment you made about last in, first out on brain cells?
Sure. So the brain takes many years to completely develop. We think of 18-year-olds as being adults or maybe 21-year-olds as being adults, but really the brain doesn't fully mature until we're about 26 or 27. And the last portions of the brain to develop, for example, the frontal lobe, followed earlier a little bit by the temporal lobes and the white matter, it basically, when the brain begins to deteriorate, it goes in reverse. So it starts with the last areas that were developed, which are the frontal lobes, and then followed by the temporal lobes and the white matter. So kind of interesting the way that works is that, you know, that brain development, like much in our bodies, but especially the brain, develop in a very clear sequence. And as the brain deteriorates, it just moves backward in the same sequence. Hope that helps.
I'm sure it will. Jeremy Yenser wants to know, is this a one-way street, or is there any way to encourage or help the brain bounce back? Or did this shave off some brain lifespan permanently?
So, I'll kind of jump in, and maybe Dr. Hahn can fill in more details than me, but, we do know there's a number of things that we can do to help our brain health, and they're all basic things, really, right? Exercise is absolutely critical, and that's been shown in a number of studies. And when we talk about exercise, I'm a primary care doc, so I can't help but counsel on this a little bit, but we're talking 150 minutes every single week of moderate intensity, getting that heart rate up. Those things are really, really important. Good diet. There's been a number of studies on the Mediterranean style diet and its beneficial effects on brain health, and so we know that can help. Adequate sleep, 7 to 10 hours a night, stress reduction, social connections, as we've talked about, and then controlling your vascular risk factors, right? Hypertension, diabetes, cholesterol. If we can control all those sorts of things, that's really the best thing that we can do for overall brain health. And I think we do see some recovery to some extent, but I don't know.
Yeah, that's exactly right. I would have said exactly the same things. These approaches are ones that we use in almost everything neurologic, and of course it can apply to our overall health as well, certainly our cardiovascular health. But we are extrapolating. We haven't really done studies exactly with this and this population, but we have in other neurologic populations that have some similar problems. So I think this is exactly the right approach.
Yeah.
Vera has two questions. Vera wants to know, number one, did COVID bring about any sort of COVID PTSD? And her second question is, how do I get someone into the long COVID clinic? I feel like my son-in-law would benefit in a long COVID clinic, and I can't find a way to get him in a consistent long COVID clinic.
Yeah, so I can take that last question first here. And so, unfortunately, the volume of patients that we saw was so large that we kind of adopted a different strategy at KU, where we said we have to spread this out amongst all of our primary care physicians. I think Dr. Kimmer probably knows the number better than me, but probably 150 or so primary care physicians across our system now. And so we've taken a concerted effort to make sure that we educate all of our primary care physicians and they can take care of this, because the numbers were just way too large for one clinic to really kind of take that on. And so the best thing to do is contact primary care doctor, and then they should be able to help connect to the appropriate specialist, whatever that might be, in this case neurology for brain fog or something along those lines. And so that's really the strategy that we've taken here.
Jim has a question about supplements, so I want to get to that real quick. Jim wants to know, is there any sort of supplement that might work to clear up brain fog?
I wish. Unfortunately, we don't have one. But I also will add to that sometimes we assume that brain fog or cognitive issues are related simply to an infection or some sort of event or problem. But oftentimes there are multiple factors. And so I always encourage folks to get a workup, have some blood work, check your vitamin levels. Let's make sure we don't have something else superimposed. Sometimes things are not as simple as they seem, and there can be multiple factors. So worth looking into, but no specific supplements that I can recommend, unfortunately.
Yeah.
I think we all wish. Maybe someday. This has been a great discussion. I'm grateful to our guests for being here. I wanted to get to final thoughts before we go. Dr. Hahn?
My final thought is we need more research. We need to be able to replicate what has been shown in this study or refute it. And we need more treatments for things like long COVID, including the neurologic complications that have occurred and that we've seen. So more to come.
Comfort?
I just say a big shout out to all of our researchers. They've been working hard over the last several years and really quickly put together a pretty robust research platform across the country, not just here, but across the country. And so that really helps folks like me, who's primarily clinical and seeing patients, and just really appreciate all the work that all our researchers here and across the country do for this.
Yes.
We also asked Dr. Castro for what he wants us to take away from today's program.
I think what we've learned from this study, and substantiated by some other work as well that led to it, suggests that long COVID does accelerate aging. And so with that information, we now need to figure out how do we combat that? How do we prevent that from happening? And we are actively studying effects on memory loss. We're studying effects on, protecting the brain protective type of strategies. And so I think now we need to kind of put this into the equation, that accelerated aging and its effect on the brain. Well, we need to consider the effects of a virus like COVID.
Well, brain health is important to us here at University of Kansas Health System, and there's some large announcements coming forward about that shortly. So please take care of yourself. Come see us at the health system. We're glad to take care of you. Thanks again to all our guests and to our audience. And remember, faith, hope, and science.
I'm Alexis Del Cid. On the next All Things Heart, what do you do when specialized medical care is hours away from where you live? We'll show you how the Care Collaborative is a lifeline for so many patients, bridging that gap. Thursday at 8 a.m.
Subscribe to our morning medical update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.